Hey, it's Dr. Loren. I just wanted to send you a quick video introduction of me. I know we just started chatting on LinkedIn. Wanted to give you a little more of a background about me, about my company, and what our core values are, and if it's a good fit for you. I'd love to have you introduced to some of my team members and the dentists in the group, and ultimately, if you'd like to come out and visit the practices, I'd love to have you come out and see Oklahoma. So I'm from Logan, Utah originally. I grew up on a farm in Logan. I had pigs, sheep, cows, horses, all that fun stuff. After dental school, my wife and I and our two kids, we decided to move to Oklahoma City. Oklahoma has been a fantastic place. We absolutely love it. It's a great place to raise kids, all sorts of awesome things to do for families. On the business side, it's awesome as well. With in dentistry in particular, fee schedules are high. You're making more for the same amount of work you might do, in another state. Investing, if you want to do real estate investing, there's awesome opportunities to do a lot of that here as well. So, anyhow, Oklahoma has been fantastic for us, and we've loved it. It's been awesome. So how I got into the group practice space, I was in dental school originally when I started learning about it, and all these corporate offices would come and recruit at the dental school. I went into dental school not knowing what corporate was. I didn't know what a DSO was. I didn't know what corporate dentistry was, and quickly learned that the dental industry is going in the direction of group practice, whether that's corporate or DSOs, whatever you want to call it. It's definitely going in that direction. And I decided to create Positive Impact Dental, which is a private practice group model where dentists can partner together and work together in a group practice setting without having to have some of the negatives of corporate dentistry, right? So I started buying practices and partnered with other dentists. And the goal and the mission of my company is, how do we provide mentorship, autonomy, and a great financial opportunity for dentists, right? There's so many aspects of dentistry that are changing right now and are hard to keep up with when you're on your own. So how do we preserve that private practice setting and that private practice model while also providing that mentorship and that autonomy, and then also the financial upside? So in terms of the mentorship, one of the big things that I do in my group is we provide a lot of CE. Every month we're doing study clubs, right? So we're collaborating with each other. We're doing a study club. We have a specialist come in and present on a certain topic. We do this summer. We're doing endo CE. We're doing implant CE. We do hands-on CE as well. So we're going to be doing implant placement, right? Where a doctor can work with a supervising doctor and place, even if it's within their first 2-3 months out of school, be able to place implants or be able to extract impacted wisdom teeth and do it, hands-on with another doctor that's right there and can step in and mentor and help and supervise, right? Also, hands-on mentoring in the offices. So me and some of the other mentor doctors will come into the office with you. And if it's your first implant in your practice, I'll come in, I'll assist you. Or if you don't feel comfortable, you can assist me. And then on your next one, if you feel more comfortable then I'll assist you and walk you through the whole process and make sure that you feel comfortable being able to do that and not feeling like you're completely on your own. So those are a lot of big things. The other aspect of mentorship is just collaboration. If you have a group of like-minded dentists and we all work together on helping each other when we have questions about treatment plans or big cases that you're not sure what to do with, we have a group text, or we'll do on the study club, or just call me or another dentist in the group and get advice and get help. So that's a big aspect of what we do in the group. And then on the autonomy side, a lot of new grads are worried that they're going to go into a space where they're going to be asked to do things they don't feel comfortable doing. Either they don't agree with that diagnosis or they're just not clinically ready. in my group, you treat what you diagnose, right? So that's 100% on you, and that's 100% on what you feel is best for you and the patient. If you need to refer it, you can refer it. If you want to learn more about a certain aspect of dentistry, I want to be there to help support you and help you be able to do that, right? But ultimately, it's your decision of what you want to do, what you want to treat in all those areas. And I'd like to say that autonomy is good, but having supported autonomy is really what you should be looking for. You want the ability to to have that independence, but have somebody there that can support you. On the leadership side as well, right? So if you have problems with a team member, like you are the leader in the office, and if you don't feel comfortable being a leader, that's something that me and the other docs are able to mentor on. And then lastly, just financially, dentistry is a fantastic profession. You can make as much money as you want to make. The docs in our group are making well above the national average. Just even the associates, right, new out of school, most of our docs are within the first 6 months, well above the national average on dentist earnings. And not just that in terms of doing the dentistry and getting paid for that, but also the ability to be financially rewarded on the ownership side and becoming a partner, whether that's within the first 6 to 12 months, or if you don't feel comfortable, the first 2 to 3 years. So I'd love to have all the doctors eventually become partners. It's not a requirement, but it's something that I have as an option, as an opportunity to be able to invest into the practice that you're working in and become a partner there, as well as the group as a whole. So anyhow, that's like I said, that's just a little bit about us and what we stand for. Mentorship, autonomy, and having a lot of opportunities for docs to succeed and grow financially. I hope we can chat soon, and let me know if you have any questions, and we'll go from there.